Hello everyone, it's Nurse Amy, and in this video we're gonna learn about taking vital signs. Firstly, the question is, what are vital signs? Vital signs are the physiological signs to monitor the functions of the body. It includes pulse, temperature, respiration, blood pressure, and oxygen saturation. The next question that arises is, why do we need to attend the vital signs? Because it helps the nurse to identify the normal and abnormal findings. It helps in providing an early indication of deterioration and also the reporting of abnormal findings on timely manner, along with the vigilant documentation of the findings. On the screen, the table shows the normal ranges of the vital signs. The body temperature's normal range is between 36 to 37 degrees Celsius. Pulse is 60 to 100 beats per minute. Respiration is 50 to 20 breaths per minute. Blood pressure is 120 by 80 millimeters of mercury. Oxygen saturation is between 95 to 100%. Now coming to the first vital sign, body temperature. What is body temperature? Body temperature is the balance between the heat produced by the body and the heat lost from the body. Body temperature can be assessed from the different sides of the body, like oral, from the oral cavity, rectal, from rectum. The temperature measured from rectum is mostly accurate. Axillary, from armpit. This site is preferred in mainly newborns. Tympanic membrane, from the nearby tissue in the ear canal, and temporal artery. It is measured with electronic or infrared thermometer on the forehead. Now the changes in the temperature. What if the temperature is less than the normal range, and what if the temperature is more than the normal range? If the assessed temperature is not in normal parameters, then two major alterations of body temperature can be seen. If the temperature is below the normal range, it is called hypothermia. Some visible clinical signs of hypothermia are pale, cool, waxy skin, hypotension, shivering, colds and chills, disorientation and drowsiness. And if the temperature is above the normal parameters, it is called pyrexia or hyperthermia. Some visible clinical signs of pyrexia are sweating, increased heart rate, increased respiration rate, flushes, and warm skin. Now coming to second vital sign, which is pulse. Pulse is rate, rhythm, and volume of heartbeat, and calculated as beats per minute. The normal range of pulse for adults is 60 to 100 beats per minute, and for newborns it can vary from 80 to 170 beats per minute. Pulse can be assessed from different sites, but the most common used site is radial pulse, which can be assessed from inner aspect of the wrist. Now coming to the next vital sign, which is respiration. Respiration is the act of breathing that involves inhalation and exhalation. Inhalation is the taking of oxygen in, and exhalation is the release of carbon dioxide. Normal respiration rate in adults is 15 to 20 breaths per minute, but in newborns it can be 40 to 60 breaths per minute. Breathing patterns can differ on the basis of rate, volume, and rhythm. Breathing patterns on the basis of rate. Tachyapnea, which means quick and shallow breathing. Shallow breathing uses only small volume of air for inhalation and exhalation and minimal use of lung tissue. It causes high respiration rate. Bradyapnea is abnormally slow breathing, which means low respiration rate. And next one is apnea, is temporary cessation of breathing. This normally happens during the sleep. Now coming to the breathing patterns on the basis of volume. Hyperventilation, which is overexpansion of the lungs, usually rapid and deep breaths. Here, deep breath means using large volume of air for inhalation and exhalation, and then hypoventilation, under expansion of lungs and shallow breaths. Now, coming to the breathing patterns on the basis of rhythm, which is Cheyne-Stokes breathing. It is the specific form of periodic breathing, or we can say rhythmic waxing and waning of respiration from very deep to very shallow breathing. Now, coming to another major vital sign, which is called blood pressure. It is the measure of pressure exerted by blood as it flows through the arteries. We all know that blood flows in the waves, so there are two blood pressures, which is systolic and diastolic. Systolic is the pressure created on the contraction of the ventricles. Diastolic is the pressure in the arteries at all the times, and the difference between both systolic and diastolic is the pulse pressure. Blood pressure is measured in millimeters of mercury mmHg. The normal range of blood pressure for an adult is 120 by 80 millimeters of mercury, where 120 is systolic pressure and 80 is diastolic pressure. The blood pressure is measured with the instrument called sphygmanometer, and while measuring blood pressure, 5 phases of sounds called Korthoff sounds can be heard via stethoscope, from very sharp tapping in phase 1 to silence in phase 5. Another major vital sign is oxygen saturation. Oxygen saturation is the measurement of person's arterial blood oxygen saturation levels. It is measured with pulse oximeter, and the normal range is 95 to 100%. Hypoxia in body can be caused by low oxygen level in body tissues. So friends, in this video we learned about the assessment of vital signs. However, pain assessment is also the major vital assessment, as pain can be the factor leading to vital observations outside their normal parameters. We will learn about the pain assessment in the next video on our channel The Compassionate Nurse. Till that time, please don't forget to like the video and subscribe the channel. Thank you.